अप्रैल फूल्स डे इज ऑल अबाउट फन एंड प्रैंक्स, लेकिन क्या पता अगर आपका कोलेस्ट्रॉल भी आपको साइलेंटली फूल कर रहा हो। ये जो इंक्रीज लेवल ऑफ कोलेस्ट्रॉल है, ये आपके हार्ट के हेल्थ को बिना किसी वार्निंग के रिस्क में डाल सकते हैं। जस्ट बिकॉज यू फील फाइन doesn't mean that everything is fine. Namaste and welcome everyone to another episode of Beyond the Pill, where health meets conversation. I am your host Dr. Chetna, and today we will be talking on cholesterol and understand what is LDL, HDL, and most importantly, why low is better when it comes to lipids. To make us understand this better, joining us today is a very renowned cardiologist, Dr. Subhasish Roy Choudhury, serving at the Department of Cardiology at Manipal Hospital, Broadway, Kolkata, with over 22 years of experience in this field and 11 years of expertise in the specialization. Dr. Subhasish Roy brings extensive knowledge and skills to his practice. Hello, doctor, and good evening.
Hello.
And thanks a lot कि आप टाइम निकाल कर अपने इतने बिजी स्केड्यूल से टाइम निकाल कर हमारे शो में आए, which is Beyond the Pill. So how do you feel about it?
I'm feeling great. I think it's a great opportunity to interact with you and with the masses and to tell you something interesting about cardiology.
So firstly, I want to know ki how do you feel like being a doctor, being a cardiologist especially? Like, do you like your work? Do you like what you do? Does it make you tired, or you are happy, you're enjoying the field?
Cardiology, especially interventional cardiology, is a very exciting field because it makes you do things within the patient's heart. You see patients when they're in the most difficult times, and in majority of the cases, you are able to help them out. That makes you feel good. But yes, being a doctor overall is about doing a job without thinking about the results, which are not always under your control.
And especially being a cardiologist, I feel it's like a blessing also, because सबसे ज़्यादा problem जब होती है, जो भी difficult problem है, it's always related to heart. And if you are able to serve the country or people, I think you must be feeling really satisfactory at the end of the day, right?
Yeah, being a cardiologist is like you touch the heart.
Yes, that's a beautiful thing that you said. So if not a cardiologist, then what would have you been?
Maybe a NASA scientist.
NASA
Yeah.
scientist. Wow. So you want to go to the moon?
With Sunita Williams, I think that's the craze of everyone nowadays.
I think you can still do it.
Oh, thank you. I'll try.
Okay, so now coming back to your routine job, which is seeing patients. So what kind of patients do you see on a regular basis? Like which condition do they come to you?
And majority of my patients are like they come with hypertension, dyslipidemias, chest pain. Many of them are worried that they have a heart disease when they don't have one. That's
Okay,
that's a
okay.
major chunk of patients that I do see. So other than treatment, also I think telling them that it's okay, they don't have anything, is forms a major part of my job.
Okay.
So distinguishing between the ones who really need treatment and the ones who are really okay but just about worried is, I think, one of the major things that I do in my day-to-day OPD practice.
Now there is a big link between the word cholesterol and heart. मतलब people usually know कि cholesterol है, मतलब you are at risk of having a heart disease. So whenever you see these patients having cholesterol, which age group do they fall in?
And a
Majorly.
majority of them are in their early 40s, 50s when they start worrying about the cholesterol. Before that, people are just enjoying life. But yes, I do get patients who have had their parents having heart attacks or chest pain, so they know a little bit about hypertension and diabetes and cholesterol. Nowadays, there's this good thing about all corporate jobs. They get their
Yes.
annual checkups done.
Yes.
So I do get a lot of patients who have their annual checkups and they had high cholesterol in their uh, reports. That makes them worried. But yes, heart is one thing that people are really worried about. And I think cholesterol is only one of the many risk factors, but definitely is one of the most well-known risk factors.
Right. So focusing more on cholesterol. So if a patient comes to you कि doctor मेरा cholesterol बढ़ गया है, so what do you start with? What do you tell them? Because I don't think they know what exactly is cholesterol, and then why cholesterol have this bad reputation always.
One thing that we need to understand from the doctor's perspective is that when you come and tell me, Dr. Saab, मेरा cholesterol बढ़ गया है, I look at who is the person there.
Right.
So this is called risk profiling.
Yes.
So suppose I have a 25-year-old female coming and telling me मेरा cholesterol बढ़ गया है, I'm less worried. I have a 65-year-old obese, diabetic, hypertensive, with a family history of heart attack, telling me मेरा cholesterol बढ़ गया है, I am worried. So that's called risk profiling. That's how the cardiologist sees cholesterol, because cholesterol is one of the many risk factors in having a coronary artery disease, which is like what is coronary artery disease? These are blocks in the heart.
Blocks in the
so
heart.
Everything that we are worried about with cholesterol is that if I have high cholesterol, I'll have a heart attack. So that's
the thing people know.
That's what people know, and that's part of it is correct. But then the way I say it is that it's one of the risk factors. It's not the only risk factor.
Right. So what are the ideal levels of this cholesterol, and is it that way कि patient with only cholesterol should have certain levels of cholesterol, whereas as compared to patient with diabetes, hypertension, or any other comorbidities should have certain level of cholesterol?
Right. Again, to answer that question, we should understand that when we speak of cholesterol and it being only one of the risk factors, so what are the other risk factors? There are a host of other risk factors, and all of these risk factors, some of them are modifiable risk factors and some of them are non-modifiable risk factors. What does that mean? That means, let's say age, sex, family history, we cannot modify them.
Right.
So if I am 65 years, then I am 65. If my parents had a coronary artery, then they had a coronary arteries. I will not be able to modify them. But then there are some modifiable risk factors, like let's say smoking. So if I'm a smoker, I can stop it. If I'm diabetic, then I may control my sugar. If I'm hypertensive, then I'll be able to control my BP. Similarly, cholesterol is a modifiable risk factor. So if I'm dyslipidemic, which means if my cholesterol levels are higher, then I'll be able to modify my cholesterol with the help of some medicines. Once I modify my cholesterol, that brings down the risk of having a cardiovascular event, of having a heart attack. Unfortunately, it doesn't mean that it makes me immune from a heart attack. Or converse to that, if I have a high cholesterol, it doesn't necessarily mean that I am going to have a heart attack tomorrow.
Right.
So it's all about risk profiling.
Okay.
All that we can do is reduce the cholesterol to reduce the risk of having a cardiac event.
Okay, so the optimal level of cholesterol depends on individual to individuals. Is it that way?
Exactly. So that depends on how much at risk you are of having a coronary artery disease. So for example, someone who is diabetic, who is hypertensive, who has some target organ damage, like let's say eye problems, kidney problems, or maybe who has suffered a heart attack, or maybe so I've done an angiography in that person and seen blocks in the heart. So in that person, we would target an LDL cholesterol of as low as 55.
Okay.
For someone else, that will be like 70. For someone else, that will be like 100. But even in an asymptomatic person, that's a person who has got no symptoms, if he has a family history, if he has some diabetes history, then we would target something around 100. So if you're asking for some level for a common man, maybe that should be 100. Everyone should target an LDL cholesterol of less than 100.
Less than 100, okay. So is it said that Indians have a different cutoff cholesterol level as compared to...
It's actually being
countries.
Born as Indians, as Southeast Asians, we are very much prone to have diabetes, cholesterols, heart attacks, and that's a non-modifiable risk factor. We can't modify that. So what we can do is we should target as low a cholesterol as possible.
So that is how it is supposed to be. But then I just met someone who's like, being an Indian, it's this way कि Indians को cholesterol होता ही है. इसीलिए you need not worry the cutoff if it's example it's 100, because Indians have this tendency of getting cholesterol, so you need not worry. You can also keep it up to 130, 140 because that's also normal.
No, there's nothing like that.
So people are spreading such message.
No, not at all. In fact, now we have guidelines made in India by the Cardiological Society of India. So this is Indian guidelines which recommend that again there should be low risk, moderate risk, high risk, and very high risk. But even in the moderate risk, it should be less than 100.
Less than 100.
In the low risks, it should be less than 115. And we are speaking of LDL cholesterol.
Right, understand. So, we also have this mentality that people who's obese and is overweight will definitely have cholesterol. Whereas if you are on a leaner side, so you may not have the chances of having a cholesterol. So you need not lead a very healthy life. But we just have this impression कि मोटापा है, unhealthy है, so you will definitely get cholesterol. Is it that way?
No. So that's what I was trying to explain to you. You're very unfortunately, it's not a 1:1 relation. It's not like suppose I have a LDL cholesterol of 70 and you have a LDL cholesterol of 140, then you are twice at a risk of having a heart attack. It's not like that.
Okay.
Because there are many other risk factors at play. Obesity, hypertension, diabetes,
Correct.
and how they will affect is not like it's not numerical factors that you add them up and you 3 times,
not
4
that way.
times. It doesn't work that way, unfortunately. Had it been so, then I would have known that if I am a non-diabetic, non-hypertensive with normal cholesterol, then I will not. I am going to have a heart attack. Unfortunately, it doesn't work
Not
that way.
Okay.
But yes, again, definitely the person who is not obese, who is not diabetic, and have an LDL within the target, the chances of him having a coronary event is much less. So that's the reason that we should be targeting lower LDLs.
Okay. So what according to you can be the risk factors of developing cholesterol or leading to increase the level of cholesterol?
Other than the fact that everyone has got their own genetic predisposition to a different cholesterol, non-modifiable, definitely the lifestyle that we live, the food that we eat, that affects the cholesterol levels in the blood a lot.
Okay, so what are the symptoms or warning signs that people need to be aware of to know कि okay, this could be the symptoms of increased cholesterol levels in my body?
There are no such signs and symptoms, unfortunately.
So, sir, knowing that cholesterol is a silent killer and it doesn't really show symptoms, so how would one understand कि okay, now these could be the actual symptoms of high cholesterol in my body?
No, there are no symptoms. So there comes the importance of doing regular blood tests. So a routine screening, without any symptoms. The routine screening would pick up your high cholesterol levels, and that would initiate lifestyle modifications, dietary changes, maybe medicines in some cases, which would bring down your cholesterol level, which will reduce your risk of having coronary events. But then you will have no symptoms. It's not like if you have a high cholesterol, you'll have a chest pain. If you have low cholesterol, you have no chest pain. It's not like that.
Understood. So that's why I think today it's very important for us to promote how much routine checkup and these screenings are important for people from a maybe age group of 40, right?
Definitely. All the risk codings, all the charts that we get in our offices, they start from the age of 40. Why so? Because the risks start rising after the age of 40, especially when we divide it across males and females. Females in general, in their reproductive age group of 15 to 45, they are protected from heart diseases. But once they near 40, 45, their risks start rising abruptly, so that by the age of 65, males and females have got the same risks of having coronary diseases.
Okay.
So maybe 40 is the correct age to start screening. Before that, if you have high cholesterol, it's usually hereditary. So there are some hereditary disorders which causes high cholesterol, and those are usually picked up in maybe some routine examinations in school or when you get your first job, but they are a different subset.
Okay. So by this you mean that cholesterol is more commonly seen in high cholesterol, I'm sorry to just use cholesterol, high cholesterol levels are more commonly seen in men than women?
Exactly. The risks of heart attack, if you see the risks of heart attack, the non-modifiable risks, the first comes is male sex.
So it's not because women trouble them, right?
Maybe yes.
No, it's not that way. No, it's because of the other factors as well.
Right.
No, like which is smoking and then alcohol.
It's because there's a natural protection, and that comes from the hormones. So once the females are in their reproductive ages, they have got all these protective hormones. But once they're devoid of the estrogen, then the risk factors tend to increase. So that by the age of 60, 65, you have male and females equal risk of having a heart disease. And speaking of smoking, since you did mention it, smoking is a very modifiable risk factor which should be stopped. And more so because over the last maybe a decade or so, I think our nation has seen multiplication in terms of female smokers, which was not
That
there
is
maybe a
true.
couple
That
of
is
decades
true.
ago.
Yes, yes. That's what I don't think people realize that action taken today or maybe smoking doing today is going to have a very bad effect long term. They don't realize
No,
this.
when we were in college, we didn't also realize.
Oh, so honest of you to answer this.
But I'm not a smoker,
You are not now.
not even ever.
So good. See
Not
cardiology.
ever.
Acha, not okay. So talking about more focusing on lifestyle. So what do you think? What kind of lifestyle one should have in order to prevent high cholesterol?
And once we speak of lifestyle, I think if what comes at number one is exercise.
Hmm.
And what I mean by exercise is regular exercise, at least brisk walking, 30 minutes a day, 5 days a week, that should suffice. But any kind of exercise, any, call it yoga, aerobic exercises, cycling, swimming, any kind of exercise done on a regular basis is the most important thing which can change your lifestyle.
Okay, okay. So exercise can significantly lower the levels of cholesterol.
Exactly.
Okay.
Done regularly, it can.
And then other than exercise, what about diet? I mean, usually most of the people think that diet also has a major role in cholesterol. They'll ask you to restrict oil. They'll ask you to restrict egg yolks and cheese, butter, and dairy products.
Diet is again a big topic which you can keep on speaking for hours about how it affects your cholesterol levels. To make it very brief, I think there are a few things that we can do. We can stop saturated fats, trans fats. So what's that? That's basically ghee, butter.
Understand, yeah.
We can restrict the amount of oil that we are taking. Restrict the amount of fried foods that we are taking. I know it's very difficult because Indian cooking is all about frying. We
Yes,
don't grill and we don't steam.
Correct.
But then restrict it as much as possible. And I think I need to mention that eggs are like इतना भी खराब नहीं है. Because it's not only
जितना
about
उसको
the
बना दिया है
इसको
खराब.
बना दिया गया है. Because it's not only about the yellow part, there's also a white part of the egg which is not cholesterol.
Yes.
And it's not like that if you take 1 gram of cholesterol, that 1 gram is going to get deposited in the heart. So eggs should be taken regularly, maybe not daily. They should be restricted, that's true. But much worse than eggs are the fried food, the trans fats, the saturated fats, which should be shunned.
Yes, that's right. And then how much impact does poor sleep or a lot of mental stress play in this?
These are all interrelated. You'll find the person who is obese, he is more likely to suffer from something called an obstructive sleep apnea, which is again a medical disorder, which causes a lot of snoring, which causes poor sleep, which causes daytime drowsiness. All of these lead to hypertension, which leads to dyslipidemia, which leads to coronary artery disease. So it's a kind of a vicious cycle.
Okay. So it's important to have a good sleep to keep your health actually in place.
It's very important.
Then coming to the medical treatment part of it. So what about the medications? If once you start with the cholesterol medications, has to be continued lifelong?
That's a very common question. एक बार शुरू करे तो जिंदगी भर लेना पड़ेगा? Usually yes. Usually yes, because you're going to live your life with all the risk factors that you started off when you started the medication. But then at number 1 comes lifestyle modification, at number 2 comes dietary restrictions, that number 3 comes medications. There's no use doing number 3 without the 1 and 2.
Correct. That is important.
Medications will be decided by your cardiologist. So that's my job, to write a few prescriptions. We have choices of 3 or 4 medicines. Up titrate them as and when required. Majority of them are oral medications. Some of them are injectables. They are a bit costly. But the target is to get your LDL cholesterol to the target levels that's planned.
So are there any strategies to have a good HDL cholesterol?
Now again, this is something that many of my patients tell me कि what about the good cholesterol, sir? उसको कैसे बढ़ाया जाए? And the only way to increase it is exercise.
Good. Nice one. Okay. So lastly, talking about something which I think that people really don't talk about, and even there's very less awareness. they just know कि cholesterol बढ़ रहा है और इसके ये lifestyle ये वो सब reasons है. But what about other primary causes, like if the person is having thyroid or if the person is having diabetes or maybe some other comorbidity? So what are the chances of having high cholesterol levels in these patients?
So since you did mention thyroid, hypothyroid people, they tend to
Yes.
have more triglycerides.
Yes. Okay.
So treating the thyroid itself would lower down your triglycerides. In connection with this, there's one thing that we should understand. When we are speaking of heart diseases, the only cholesterol that we are targeting is the LDL cholesterol.
Okay.
But the other cholesterol, like let's say the triglycerides, they do some harm to the bodies. And in fact, if you have got very high triglycerides, they can lead to diseases like pancreatitis.
Oh, okay. Okay.
But we need to cut down on the triglycerides and the LDL, and whatever medicines that we give you does that job. But the target of the therapy, that report that you get and what you see, all those figures, the target of the therapy is LDL cholesterol.
Okay, so if the hypothyroidism is being taken care of properly, so it can automatically...
Definitely it helps in lowering the cholesterol.
Cholesterol as well. Okay. So lastly, any important message that you would want to give to our viewers to maintain the cholesterol and also to prevent high cholesterols?
I think the one message is something that I keep giving to all my patients day in and day out is cholesterol ko badnaam mat karo. Cholesterol is there in your body. It does some good job. It needs to be kept in certain levels. There are many other things that needs to be kept at certain levels. There are many other habits that needs to be kicked so that you lead a healthy life. Cholesterol is just one of them, and maybe I can help you with some medicines, but you have to do it with exercise and dietary restrictions.
So it's a collective effort that is required.
Right.
So now we will do a very interesting segment that is rapid fire round. I have few questions for you, and you have to very briefly or very quickly answer to these questions. Okay.
Coffee with Karana.
Coffee with Dr. Chetna.
Okay.
Okay, so first one is one major misconception about cholesterol that needs to go.
If you have high cholesterol, you're going to die of a heart attack. It's not always so.
So it's a big misconception that people have, right? Okay. So LDL versus HDL, if you could give them a one-word description, what would it be?
LDL is a bad cholesterol. HDL is your good cholesterol.
Good boy. So next one is the most underrated habit for a heart healthy life.
Exercise. Everyone knows about it, doesn't do it.
Just as you told, unless they get a heart attack.
Unless they get a heart attack.
At what age should someone start getting their lipid profile checked?
If you're at a very high risk, like let's say you have one of your parents with high cholesterol, heart attack, maybe from an earlier age, without any risk factors, maybe 40 is good enough.
Ideal age, okay. One food people think is bad for cholesterol, but actually it isn't.
Egg.
Tell me the word in Bengali.
Deem.
Deem, okay.
Deem khave.
Okay. So what's worse, high LDL or low HDL?
High LDL, definitely.
Okay. Next is one red flag in routine checkups that people tend to ignore.
Many red flags, in fact. Cholesterol is just one of them. So you have uric acid, you have your CRP, many.
So is it like if in their reports LDL to matlab people just see LDL HDL, whatever the triglycerides?
People usually see the total cholesterol. There are very few who know that cholesterol has got so many classifications and everything, and the LDL is the only target that the doctor is looking at when he sees that report. So it's not about the total cholesterol, whether it's 200 or 250 or 300. It's about the LDL cholesterol that the cardiologist is worried about.
Right. Okay. So next is statins or lifestyle changes, which comes first?
Lifestyle changes.
Okay. The biggest mistake people make when trying to lower cholesterol?
Take medicines and forget dietary changes.
Next one and last one. If you could give one piece of advice for better heart health, what would it be?
Start early. Whatever advice that you get on the internet, on Google, and shows like this, everyone knows about all these, but you need to start following them early in life. That's very difficult to do. Easy to preach.
That's what we are trying to spread the awareness here. And thanks a lot for your time. Thank you so much for joining us. And we're really honored to have you with us today.
Thank you. Very interesting questions.
Thanks a lot. So just remember that prevention is the key. With regular screening, lifestyle changes, and with the right choice of treatment, it can make all the difference. So let's just not celebrate April Fool's Day with prank, but let's make a reminder to be wise about our health, because when it comes to heart health, low is better. So if you find our videos informative, don't forget to subscribe to our channel and follow us on Instagram at Mankind Specialities for more such valuable health discussion on various health topics. Until then, stay informed, stay healthy.